Hey everyone, it's Dr. Marcon. This is chapter 25 on the reproductive system. First, we're going to talk about the male reproductive system, and then we will talk about the female reproductive system. So some just general characteristics of the reproductive system. We have our primary sex organs within the reproductive system. Testes for males, ovaries for females, and then our accessory sex organs, glands, as well as external genitalia. Starting off with the male reproductive system, we are working our way out and then going to the internal structures. So the first structures we'll talk about are the parts of the male external anatomy. A way to remember the structures in the external anatomy is pus, P-U-S, pus. So P for penis, U for urethra, and S for scrotum. So these structures are considered part of the male external anatomy. For the male reproductive system, the testes are the primary reproductive organs of the male and are located within the scrotum. The scrotum is made up of skin and superficial fascia surrounding the testes. Now, the position of the scrotum provides an environment 3 degrees centigrade cooler than body temperature. And this is important because that temperature is ideal for sperm production. That is why when we have male patients that come in complaining of fertility disorders or having problems with fertility, we usually recommend that they don't have, laptops sitting on their laps or hot beverages or anything, because that increases the temperature of the scrotum, which could lead to disorders of sperm production. Now, there are certain muscles that are important within the scrotum. The dartos muscle is a layer of smooth muscle and is responsible for the wrinkling of scrotal skin. The cremaster muscle are bands of skeletal muscle that surround the testes and help elevate the testes. So whenever you have a patient, you tell them to turn their head and then cough. You can see that the testes will elevate, and it's due to the cremaster muscle. So here are just some of the reproductive organs of the male, a sagittal view. We can see our external structures. We have the penis, the urethra within the penis, specifically the spongy urethra, again contained within the corpus spongiosum, and then the scrotum holding the primary male reproductive organs, the testes. And just an anterior view of the contents of the testes and the relationship of the testes to the scrotum and the spermatic cord. So we will talk about these structures in just a little bit when we get to internal anatomy, but you can see here's the scrotum. We see the superficial fascia containing the dartos muscle. Again, dartos being a smooth muscle, and then the cremaster muscle being that layer of skeletal muscle. So the penis is part of the male external anatomy. There are different parts to the penis. There is the shaft that makes up the body of the penis, and then there's the glans penis, which is that distal expanded end. The prepuce is also known as the foreskin of the penis, and this is the structure that is removed during circumcision. So moving on to the internal anatomy. The internal anatomy of the penis. Within the penis, there are 3 erectile bodies. We have one corpus spongiosum. This is the part of the penis that surrounds the spongy urethra, which we talked about during the urinary system. And then we have 2 corpora cavernosa. Notice there are 2 C's, CC, so that means that'll help you remember that there are 2 corpora cavernosa. The 2 corpora cavernosa contain sinuses within these structures and make up most of the penis. Now, the male sexual response for erection, this is under parasympathetic control. and then ejaculation is under sympathetic control. Now, the body of the penis is made up of many layers. You have the outer fibrous covering or capsule of the cavernous bodies. This is the tunica albuginea. And then you have the deep fascia or the buck fascia. This is a strong membranous covering that will bind the corpora cavernosa as well as the corpus spongiosum together. So this buck's fascia actually covers all three cavernous bodies. And then you have the dartos layer. This is a layer that is a discontinuous smooth muscle between the skin and the deep fascia. So again, the layer that, if we see a cross-section of the penis, the layer that surrounds the two corpora cavernosa, we have the tunica albuginea. And then we have the buck's fascia that will surround all three of these cavernous bodies. So up here is actually a better picture of the different layers. So again, the tunica albuginea surrounding the corpora cavernosa, and then the buck's fascia, which is the fascia that surrounds all three, the corpora cavernosa as well as the corpus spongiosum. And then the smooth muscle layer, the discontinuous smooth muscle layer being the dartos layer. Okay. Now, the glans of the penis is just an expansion of the corpus spongiosum distally. You have the corona of the glans, which is sort of the lip of the glans penis, and then you have the neck of the glans. The prepuce, or the foreskin, this is the layer of skin that is cut during circumcision, and then underneath on the ventral surface, you have a frenulum of the prepuce. And then at the glans penis, you'll have the opening, so the external urethral orifice where urine exits the body. We'll then get into the male internal anatomy. So basically everything else makes up the male internal anatomy. You have the testes, the epididymis, the ductus deferens, the seminal vesicles, the ejaculatory ducts, prostate gland, as well as the bulbourethral glands. So all of these structures helping participate, or the majority of these pictures helping to participate in the formation of sperm. Starting off with the testes. So the testes are the male gonads. They're roughly plum-sized. These are a pair of ovoid male reproductive glands that produce the male germ cells, or the sperm, as well as male hormones, specifically testosterone. Now, the testes are suspended in the scrotum by the spermatic cord, and the left is more inferior than right. Fellas, if you don't believe me, go check. So the tunica albuginea is the tough, fibrous outer surface of the testes. You then have a visceral layer of the tunica vaginalis. Visceral, again, being meaning organ, so that's the layer that adheres to the surface of the testes. So the visceral layer of the tunica vaginalis covers the surface of each testes except where the testes attaches to the epididymis and spermatic cord. Within the testes, we have structures called the seminiferous tubules. The seminiferous tubules are structures that produce sperm. Other structures within the testes are the Leydig cells. So the Leydig cells are important because they produce the hormone testosterone. So the testes are enclosed in a serous sac called the tunica vaginalis, and then also we have the tunica albuginea, which is a fibrous capsule of the testes. The tunica albuginea will divide each testes in about 250 to 300 lobules, and each lobule contains 1 to 4 coiled seminiferous tubules. Again, the seminiferous tubules being important to produce sperm. Then we have the structure called the epididymis. The epididymis is a comma-shaped structure on the posterior testes. Please note the spelling of epididymis and practice the spelling of epididymis. Epididymis. Okay, so practice that spelling. A lot of people tend to get the spelling of this structure wrong. So the epididymis is the site of sperm storage and maturation. So this is where sperm is stored and matured. So the epididymis is an elongated structure. It looks like a worm on the posterior surface of the testes and consists of a head, a body, and the tail. Now the head has about 12 to 14 efferent ductules. The body is a convoluted duct of the epididymis, and then the tail is continuous with the next structure, which is the vas deferens or Ductus Deferens. Now the duct of the epididymis is about 6 meters long when uncoiled, and it is dominated by pseudostratified columnar epithelium. This epithelium will bear tufts of stereocilia, which are immotile long microvilli, and it's about a 20-day journey for sperm to move through the epididymis. They are able to gain the ability to swim and to fertilize an egg through a reaction called the acrosomal reaction. So the next slide shows you a picture of the testes, the structures within the testes, as well as the epididymis. Here we see the testes and the outer layers, including the tunica vaginalis. We know that the visceral layer of the tunica vaginalis is closely adhered to the testes, and the inner fibrous layer of the tunica albuginea surrounds the seminiferous tubules. We have the cavity of the tunica vaginalis and then the outer parietal layer of the tunica vaginalis. So within the testes, we have the seminiferous tubules. This is the site of sperm production. And as after sperm are produced, they then go towards the epididymis, this worm-like structure posterior to the testes. So we can see that there's the head of the epididymis, the body of the epididymis, and then the tail of the epididymis. So it kind of turns and then moves up. So the tail of the epididymis is continuous with the ductus deferens or the vas deferens. So we can see that the ductus deferens or vas deferens will then go up to the spermatic cord to enter the pelvis of the male. Now, the spermatic cord is an important structure because it houses the blood vessels and nerves of the testes, specifically the testicular artery, giving blood supply to the testes. Here's a gross specimen of the testes. Again, we see that outer tunica vaginalis and the cavity of the tunica vaginalis. So here's the testes. Inside would be the seminiferous tubules, which will then drain into the epididymis. So we can see the head, the body, and the tail of the epididymis, which will eventually become the ductus deferens or the vas deferens, going up into the spermatic cord. And this is just a histological picture of the seminiferous tubules within the testes. So we can see the sustentocytes and where sperm are being produced. You can even see possibly some tails or spermatogenic cells in the tubule epithelium. So these seminiferous tubules will produce sperm, and the sperm will then travel to the epididymis. Blood supply, nerves, and vessels. So arterial supply of the testes are the testicular arteries. The testicular veins arise from the pampiniform plexus. The pampiniform plexus is the structure that helps keep testes cool. Again, the testes need to be about 3 degrees centigrade cooler than the rest of the body. So they are housed within the scrotum and allow for cooler temperatures that are ideal for sperm production. The testes are innervated by both parasympathetic and sympathetic divisions of the autonomic nervous system. The seminiferous tubules are separated by areolar connective tissue. The epithelium within these tubules consists of spermatogenic cells. These are sperm-forming cells, as well as columnar sustentocytes. These are support cells within these seminiferous tubules. Spermatogenic cells produce sperm. Now, Male patients can produce about 400 million sperm per day, and this begins at puberty. The process takes about 75 days. Now, cells will differentiate and move toward the lumen of the seminiferous tubules. We have stem cells, which are called spermatogonia. Stem cells will then become primary spermatocytes, then secondary spermatocytes, spermatids, and eventually what we know as sperm. Cystenocytes, again, these are the support cells. They surround the spermatogenic cells. They extend from the basal lamina to the lumen. There are tight junctions between cells and forms the blood-testes barrier, help assist in sperm production, and secrete testicular fluid and androgen-binding protein. Myoid cells surround these seminiferous tubules and help contract rhythmically. There are also interstitial endocrine cells that secrete testosterone, and the secretion is regulated by an important hormone, which is the luteinizing hormone. Luteinizing hormone being one of the hormones secreted by the anterior pituitary gland. So interstitial cells secrete testosterone. Just another histo slide of the parts of the male reproductive system. So we have the duct of the epididymis, again, the epididymis being where sperm is stored and matured. And then from the tail of the epididymis is then continuous with the ductus deferens or vas deferens. The epithelium of the vas deferens is important, so is the, well, they're all important. So is the epithelium of the epididymis. So we have a pseudostratified columnar epithelium. The vas deferens or ductus deferens helps with storage and transport of sperm. Histology, again, the epithelium lining the vas deferens is pseudostratified columnar epithelium. There's thick muscularis layer helping with the transport of sperm, and an outer adventitia connective tissue. So here is the sagittal view of the reproductive organs, again, within a male. So we're talking about the internal anatomy. So we have the testes. They're paired. There's two, but we're seeing one on the patient's right. So here are the testes. From the testes, the seminiferous tubules where sperm is produced will drain into the epididymis. There's the head, the body, and the tail of the epididymis, which is then continuous with the vas deferens. The vas deferens will then enter through the inguinal canal, going up the spermatic cord through the inguinal canal and then run lateral to the urinary bladder. You can actually see the ureter right there. So the ureter is more posterior to the vas deferens, and then it will run posteriorly. And then we will hit other internal structures of the male reproductive system in just a little bit. The spermatic cord contains the vas deferens, testicular blood vessels, specifically the testicular arteries, as well as the pampiniform nervous plexus and corresponding nerves. The superior portion of the vas deferens, once it has gone up the spermatic cord, will then run through the inguinal canal to enter the pelvis. And here again is that picture. We have the testes, the epididymis. Here's that cremaster muscle surrounding the spermatic cord. So the vas deferens will travel up the spermatic cord and then enter the pelvis via the inguinal canal and run lateral to and then posterior to the urinary bladder. So we can see the spermatic cord entering the pelvis, allowing for those structures within the spermatic cord to enter the pelvis through the inguinal canal. Now, if we have herniations, meaning an outpouching that occurs, usually this is due to a weakening of the muscles within the lower abdomen. So we can have herniation of intestine in the inguinal canal and scrotum. And usually this is pretty painful. So going right to the urethra, the male urethra carries sperm from the ejaculatory ducts to the outside of the male. There are three parts of the male urethra, which we talked about. There's the prostatic urethra, the intermediate part or membranous part of the urethra between the prostatic part and the spongy part, and then finally the spongy urethra, which is the urethra that runs in the corpus spongiosum. And just a reminder of that picture that we saw during the urinary system. So here is the urinary bladder. This is actually a posterior view because we can see that the vas deferens is coming in posteriorly. And then from the urinary bladder, the urethra, the first part of the urethra will be the prostatic urethra. Then you have the intermediate or membranous urethra. And then the intermediate urethra will then become the spongy urethra. And we can see a cross-section. Here below is the corpus spongiosum with the urethra running through it. Okay. And then we see our two cavernous bodies, the corpora cavernosa. Again, these are basically the erectile bodies of the penis that fill and engorge with blood during male erection. Now, it is important to know the path of the sperm. And there's actually a great mnemonic that'll help you remember the path of the sperm. And you might see this again on an extra credit question. So the path of the sperm, the mnemonic to know is 7 up. So, this is fun writing. 7 up. Okay? So 7 up is a really good mnemonic to help you remember the path of the sperm. So the S in 7 up stands for the seminiferous tubules. The seminiferous tubules, of course, contained within the testes. So S, seminiferous tubules. I'm not going to write it out. E. E stands for the epididymis. E-P-I-D-I-D-Y-M-I-S. Please remember how to spell epididymis. So from the seminiferous tubules, the sperm will travel to the epididymis where it's stored and matured, and eventually, once you're ready, it will then go from the epididymis to V, the vas deferens. So sperm will travel from the epididymis, tail continuous with the vas deferens, travel up the spermatic cord, go laterally along the side of the urinary bladder, where it will then hook up with the seminal gland and form the E, ejaculatory duct. So from the vas deferens, sperm will then travel to the ejaculatory duct. N actually stands for nothing. It's just a filler. And then from the ejaculatory duct, sperm will then travel to the urethra, goes through the distal portion of the prostatic urethra, the intermediate urethra, and the spongy urethra, and finally sperm will travel out the penis. Okay, so 7 up, a really good way to remember the path of the sperm. So we have accessory glands of the male reproductive system. The seminal glands, the glands that I showed you previously that lie on the posterior surface of the urinary bladder. The seminal glands secrete about 60% of the volume of semen. Now this fluid contains fructose to nourish the sperm. So I like to say that think of the seminal glands as the Red Bull, provides the Red Bull for the sperm. Basically, it gives energy to the sperm, so they have the energy to swim. So fructose is within the fluid secreted by the seminal glands. Fructose and other substances will enhance the sperm motility. There's also prostaglandins, and then substances that will suppress the immune response against semen, and then enzymes that clot and then liquefy semen. So seminal glands secrete basically the Red Bull, provide the Red Bull for the semen to give it its wings and allow it to have energy to swim up the penis, through the vagina to the uterus, and hopefully meet up to fertilize an egg. The prostate gland, another accessory gland, will encircle the prostatic urethra, consists of about 20 to 30 compound tubulo-alveolar glands, secretes about 25 to 30% of seminal fluid. The prostate secretions contain substances that, again, will enhance sperm motility, as well as enzymes that clot and then liquefy semen. So here we see a picture of the prostate gland and a section through the prostate gland. Again, prostate gland important for secreting fluids that will also help with sperm motility. The bulbar urethral glands, these are small pea-sized glands that are inferior to the prostate gland. They help produce a mucus. The mucus will enter the spongy urethra prior to ejaculation, helps with lubrication of the urethra, also will neutralize traces of acidic urine. So we know that the urethra is used also for the transport of urine. We want the secretions from the bulbar urethral glands to neutralize any of the acid within the urine so that the sperm will survive. So it also helps lubricate the urethra and allow for transport of sperm out the penis. Again, here we see a pathway of our sperm and male internal reproductive structures. So from the seminiferous tubules to the epididymis to the vas deferens, traveling laterally along the urinary bladder, meets up with the seminal glands, which produce the fructose, or the Red Bull for the sperm, will then go into the ejaculatory duct within the prostate gland, travel through the prostatic urethra, through the spongy urethra, and then out the external urethral orifice. Oh, in this picture, we can also see the bulbourethral glands sitting at the base of the prostate here in the urogenital diaphragm. So this urogenital diaphragm, as well as the bulbourethral glands, surround the intermediate or membranous part of the urethra. So the male perineum contains the scrotum, the root of the penis, as well as the anus. It is a diamond-shaped area between the pubic symphysis anteriorly, the coccyx posteriorly, and the ischial tuberosities laterally. So we can see on this next picture the male perineum. So we have the pubic symphysis, the ischial tuberosities laterally, and the anus and coccyx posteriorly. So it forms that diamond-shaped area. If we can actually draw that diamond-shaped area. So here's sort of like a diamond. Shine bright like a diamond. There you go. This is the male perineum right there. Okay. So spermatogenesis is the formation of sperm. Spermatogenesis is divided into 3 stages. Stage 1, this is when you have spermatogonia divide by mitosis. Type A maintain the germ cells, whereas type B differentiate into primary spermatocytes. You then have stage 2, which is meiosis 1 and meiosis 2. Meiosis 1 forms 2 secondary spermatocytes, whereas meiosis 2, each spermatocyte forms 2 spermatids. And you can see this in this next slide, spermatogenesis. So first part or first stage of spermatogenesis, you either have type A or type B cells. Type A germ cells remain, and then you have type B cells, daughter cells, which then will become primary spermatocytes, and then become secondary spermatocytes. Then we have early spermatotids, and then we have the formation of late spermatotids, and then eventually the formation of sperm. So stage 3, spermiogenesis. This is when we have 4 spermatids that differentiate into spermatozoa. Spermatozoa will shed their cytoplasm, their superfluous cytoplasm, and the spermatozoa at this point look like true sperm with a head, a midpiece, and a tail. So here we see spermiogenesis, transformation of a spermatid into a sperm. So through the acrosomal reaction, we then have the shedding of the excess cytoplasm, and then we have what looks like the regular look of a sperm. So the cystenocytes, the supporting cells, will surround spermatogenic cells. These are bound together by tight junctions, divides the seminiferous tubules into a basal compartment and an adluminal compartment. So the tight junctions between the cystenocytes will form that blood-testes barrier and protect developing sperm from the immune system. Spermatogenesis is controlled by a specific hormone, follicle stimulating hormone, FSH. Again, another one of those hormones that's secreted by the anterior pituitary gland, as well as testosterone. Testosterone being secreted by the cells within the testes. Secretions from the cystenocytes also influence spermatogenesis. For example, we have androgen binding protein, which will concentrate testosterone near spermatogenic cells, and then we have inhibin that's secreted by the cystenocytes, which will inhibit FSH, providing that sort of negative feedback loop when we want to stop spermatogenesis. Okay, so that's it for the male reproductive system. The next PowerPoint will be on the female reproductive system.